Nervous system. What is nervous system? The nervous system can develop several types of disorders which can affect the clients you care for. These disorders can cause different problems depending on their cause and the area of nervous system involved. One of the most common nervous system disorders is stroke, also known as cerebrovascular accident or brain attack. This is when the brain gets damaged due to being deprived of oxygen-rich blood. Two main parts of stroke: ischemic stroke and ischemic stroke, which occur when there's a blockage of an artery, and a hemorrhagic stroke, which occur when an artery in the brain leaks into the brain tissue.
In general, a useful acronym to remember some common stroke symptoms is FAST: facial dropping, arm weakness, speech difficulties, and time. Time is obviously not a symptom, but it's a reminder to get help as quickly as possible to minimize cell injury and maximize the chance of a full recovery. Now, most ischemic stroke are caused by thrombosis, meaning that a clot forms over an atherosclerotic plaque. This is when a buildup of fat and cholesterol forms on the inside of a blood vessels in the brain known as cerebral blood vessels and start to obstruct arterial blood flow. The main treatment for an ischemic stroke is a medicine called tissue plasminogen activator. It breaks up the blood clots that block blood flow to your brain. The best way to help prevent a stroke is to eat a healthy diet, exercise regularly, and avoid smoking and drinking too much alcohol. Epilepsy. What is epilepsy? Epilepsy is a chronic brain disorder in which groups of nerve cells or neurons in the brain sometimes send the wrong signals and cause seizures. Neurons normally generate electrical and chemical signals that act on the neurons, organs, and muscle to produce human thoughts, feelings, and actions. Symptoms: uncontrollable jerking and shaking, cold feet, losing awareness and staring blankly into space, becoming stiff, strange sensation such as a rising feeling into the tummy, unusual smells or tastes, and a tingling feeling in your arms or legs. There are many possible causes of epilepsy, including an imbalance of nerve signaling chemicals called neurotransmitters, tumors, stroke, and brain damage from illness or injury or some combination of these. Most people with epilepsy take anti-seizure medication, previously known as anti-epileptic drugs or AIDs, to stop their seizures from happening. However, there are other treatment options for people whose seizures are not controlled by ASM. Tips to avoid epilepsy: reduce your risk of traumatic brain injury. Reduce your risk of stroke and heart disease by eating a healthy diet, exercising, and quitting smoking.